It's here, the urgent, high-energy, slightly worried slowing for the bold claim. The Tripledemic is back, and this year the symptoms look identical. We are now dealing with the convergence of influenza, COVID-19, and respiratory syncytial virus, or RSV. Is that scratchy throat just a common cold, or is it the flu that lands thousands in the hospital? Is it the latest COVID variant, or is it RSV quietly spiking in your grandparents? Guessing wrong could mean you delay the right treatment, or worse, put a vulnerable loved one at risk. Listen up. We're going to give you the ultimate 3-minute symptom checker, the telltale clues that separate these three viruses. Then we tackle the most confusing new health defense this year, the RSV vaccine, and why it is now crucial for both seniors and pregnant women. Don't get caught unprepared. Let's start with the central problem. You cannot tell the difference by symptoms alone. Health authorities across the US and the UK agree that especially with newer COVID variants, the symptoms of all three viruses have converged. That's why the ultimate answer is always a test. But here is the 3-minute symptom checker, which helps you triage what kind of treatment you might need immediately. The common cold. Symptoms are usually gradual, building over 2 to 3 days. It's primarily centered in the nose and throat. A runny nose, sneezing, and a hoarse voice are common. A fever is rare or very mild. The flu, influenza. This is characterized by its sudden onset. You go from feeling fine to feeling terrible in hours. The hallmarks are a high fever, severe body aches, headaches, and crushing fatigue. The flu makes your whole body feel sick, not just your head. COVID-19, this remains the wild card. It can present like a mild cold, but watch for a continuous cough and, in some cases, symptoms outside the respiratory system, like nausea, diarrhea, or even the notorious, very painful razor blade throat reported with the latest lineages. The key is its variability. Crucial triage point. If your symptoms came on like a switch, assume flu. If they're primarily head cold symptoms, assume cold. If it's severe and includes non-respiratory issues, assume COVID and test. Serious, advisory, with a clear focus on the red flags. Now let's talk about when your triage ends and you need professional medical help. This is vital, especially given the UK's warnings of a potentially long season. Universal red flags. These are the non-negotiable emergency signs for any respiratory virus. Number 1, difficulty breathing. If you feel short of breath or are breathing faster or more hard than normal, especially in children, do not wait. Number 2, persistent pain or pressure. This could be in the chest or abdomen. Number 3, confusion or inability to stay awake. This indicates severely low oxygen levels and requires immediate emergency care. For high-risk individuals, this includes anyone over 65, pregnant women, and those with underlying heart or lung conditions. You have an additional urgent directive. Contact your doctor immediately if you develop symptoms. Why the rush? Because antiviral treatments for flu and COVID-19 like Tamiflu or Paxlovid are most effective when started within 48 to 72 hours of the very first symptoms. Early intervention can drastically reduce your risk of severe illness and hospitalization. Educational, focusing on the new science and the specific demographics. Next, let's unpack the third major player, respiratory syncytial virus, or RSV. For decades, we mainly associated this with infants, where it can cause the life-threatening condition bronchiolitis. But health systems are now hyper-focused on RSV in adults and seniors. For those over 75, RSV is not a common cold. It is a major cause of serious pneumonia and can severely worsen existing conditions like COPD or congestive heart failure. It causes thousands of hospitalizations in this age group annually. The great news is that new protection is finally available. The conversation around vaccines this winter is no longer just flu and COVID. The shot for seniors. In both the US and the UK, a new single-dose RSV vaccine is available for older adults, often targeting those aged 60 and above or 75 and above depending on local guidelines. This shot is designed to prevent severe lower respiratory tract disease caused by RSV. If you are eligible, it is a crucial layer of defense this season. The maternal shot. A second key development is the RSV vaccine offered to pregnant women. The vaccine is typically given between 32 and 36 weeks of pregnancy. The antibodies are passed to the baby, protecting them during their most vulnerable first few months of life. Action item. Don't wait for your doctor to bring this up. Check your local health authority's website, the NHS or CDC, to confirm your eligibility status for the RSV vaccine for yourself or your pregnant loved ones. So how do we prepare for this tripledemic season? It comes down to a simple 3-step plan. Step 1. Test early, test smart. Keep at-home combination tests for COVID and flu readily available. If you test negative for both, but still feel very unwell, isolate and assume you have an active respiratory virus. If you are high risk, a negative test should not stop you from calling your doctor. Step 2. Vaccinate aggressively. Get your updated current season flu shot. Get the latest COVID-19 booster as immunity wanes. And if you are eligible, prioritize that RSV vaccine. These shots are the best defense against severe outcomes. Step 3. Build your sick kit. Have a dedicated isolation spot ready. Stock up on hydration supplies like electrolyte packets, and keep an oximeter, a small device that measures your blood oxygen level. If your oxygen saturation drops below 92%, that is an immediate emergency department visit. This winter demands attention, not panic. By understanding the subtle differences between flu, COVID, and RSV, and by taking advantage of the new life-saving vaccines available, you are not just hoping for the best, you're preparing for the best. Preparation beats panic. Know the difference, know your risk group, and know your next step. Which vaccine are you most focused on this year? Flu, COVID, or RSV? Drop your answer in the comments and hit like and subscribe so you don't miss our next evidence-based health update.